Dr. Ravindran, Chairman of Arvind Group of Eye Hospitals, to speak on prevalence of cataract in Indian population and strategies for management. And all of us know Arvind is doing a leading role of prevention of blindness and needless blindness, started by Dr. V. And so happened Ravi and me are same batchmates.
Thanks, Dr. Natarajan, for the opportunity to speak in this session. So I'm going to talk about the prevalence of cataract and what are the management strategies we should have in the Indian population. I mean, there was a paper way back in 2008 where Dr. Murthy and et al. And also Dr. Praveen had projected that among the people aged 50 plus years, the cataract surgery would double from 3.38 million to about 7.63 million in 2020. And that is what actually happened. Last year, we have done close to about 8 million surgeries, more than what they predicted. But as you can see, that CSR among that age group has not become doubled. It has only marginally increased because the number of people in that population also had considerably increased. So even this doubling doesn't really help. So, but this increase in the volume of cataract surgery that happened over the last 2 decades has really helped to bring down the prevalence of the cataract blindness in the community. And all this work that had been done by as Dr. Rao rightly pointed out, by the several philanthropic organizations as a specialty, we were able to bring down the presenting visual acuity of 6/18 or less, which indicates moderate, severe visual impairment along with the blindness from 5.3% to about 2.55%. And again, the people who are blind from 0.68 to about 0.36%. So this has been a significant achievement. And this is the data we have from the 2019 RAP survey. The overall blindness is about 0.36, whereas the moderate visual impairment along with the blindness is about 2.55%, and the early visual impairment, which we are focusing now, is close to about 3%. So there is a large amount of work, nearly close to about 5.5% of the population needs some care. And that translates, if you look at the numbers, it's about 34 million people who have moderate, severe visual impairment along with the blindness, and about 38 million have got early visual impairment. That's a group. So, I mean, there's a large amount of work, almost close to about 75 million people who need care. And if you look at the presenting visual acuity of less than 6/18 or the moderate visual impairment or worse, the major contributing factor is still the cataract, which is about 71%. And again, if you look at the distribution of the blindness in the 50-plus population from the survey, I mean, contrary to what we saw in the Russian study, here the rural prevalence is much higher compared to the urban. And again, the people who are uneducated, the prevalence of blindness is way high, at least like about 8 to 9 times higher compared to the people who are educated. Which means, we also need to create access and make it affordable for the population. I'm just sharing the data from Aravind. Last year, we had done about 447,000 cataract surgeries. As you can see, nearly 60% of the patients have used the free walk-in services or the services through the camp. So which means, we have to really have way of making it affordable to accessible to the population. Here again, the survey brought out nearly 40% of the patients got operated in the government sector. Maybe between the NGO and private, probably equal number. Maybe 30% would have been operated by the NGOs and 30% would have been operated by the private. So which means nearly about 70% of the patients still look at accessible and affordable services, which means we need to ensure the access for them either through the vision center or through the screening eye camps becomes very, very important. That I look at as strategy number 1. So that's most important that we create this access. The other area we have to really look at is the gender. Here I just want to share this data. If you see here, the number of women who got operated in our hospital last year is about 56%. If you look at it is almost like 33% higher than the surgeries done in men. But if you look at the prevalence of blindness, it's almost 38% higher among the women. So being a woman itself, is a huge risk factor, which also came out in the presentation by Dr. Rao. So whether it is 2001 or 2007 or 2019, all the surveys have showed among the gender, women have got a much higher prevalence of blindness, even though it has considerably reduced over a period of time. And again, if you look at this data, here I'm projecting the surgical data of the patients who underwent cataract surgery. If you look at the age group of 41 to 50, for every 1,000 men we have operated 1,800 women. Okay, and between 50 and 60, it's about 1,500, about close to 1,600 women got operated, but that comes down. Only the 70 plus age group, the number of surgeries done in women is less, or the number of surgeries done in men is much higher. So not only the number of surgeries in women is higher, but the onset is also much earlier for these people. So and the majority, the way we also have to look at it is still the prevalence is much higher, and many of these women are also in the productive age group, where they really need a good vision to take care of them and the family. So I think how do we increase the number of surgeries in women is very important. I mean, this, whatever the data I'm showing, also has come out from several global-based study, and there are no evidence to show that it's related to the lifestyle, but it all has been related, it has been related to the estrogen, and it is hypothesized that, not strictly the concentration of the estrogen, but more as a withdrawal effect. So as the menopause set in, the incidence of cataract also becomes much higher in women. But what we have seen is there are also trials that have done hormone replacement therapy. Trials have also not shown any conclusive evidence to show that replacing them with some hormonal therapy is going to help. So we are still yet to find out what really causes this. And then what we can do is how much more we need to operate. Among women, we did a study in Theni to understand the eye care needs of the population. Here I just want you to look at the CSR. Based on this population, we found the CSR among the men is around 7,900, and it's close to about 8,000. Okay, the women, it is already higher at 10,000. So, okay. So, and overall it's about 9,000. This is one of the very well-served community, and we feel, but majority of the districts across the country, maybe half of this number, maybe like 4,000 to 5,000. It's already the highest things are happening. But even in this population, if you look at the visually significant cataract, it's about 12.2% of the people in the age group of 40 or above in men. Men is about 12.2%, whereas it is in the females, it's about 13.6%. It is already it's about 10 to 12% higher in the women, which means, in spite of operating higher CSR among the women, which is almost like, 8,000 in men, here it's about 10,000, still there are much more women who need cataract surgery, which means, we also looked at how much more. Today we are doing about 1.3, or maybe like the CSR ratio for between female and male is about 1.3. This has to become probably about 1.5, which means probably if you have to, let's say, we have to take the whole cataract surgical rate, maybe like 15,000, 5,000 maybe have to be men, and 10,000 probably have to happen in the women. So. And while the current strategy is to increase the number of surgeries, that alone probably may not help. This we also need to look at other causes. How are we going to look at the ways how we are going to delay the onset of cataract? Is it possible to prevent the occurrence, or is there a way to slow down its progression? Something we need to explore. One is, they say smoking. If you are able to bring down the smoking, and if you are able to give some kind of protection to ultraviolet, probably we'll be able to slow down. And we also did a study along with All India Institute about almost like 15 years back. And what came out there is, beyond the age and the gender, what we found is the level of the antioxidant. there was a strong association between the level of the antioxidant. That's an inverse association between the antioxidant and the cataract. And while we also saw that with the lutein, zeaxanthin, and retinol, there are very strong inverse associations what we found with the vitamin C. And now if you are able to, if you have people with a quad trial with the group of people who had a much higher concentration of vitamin C in the plasma, had the lowest prevalence of the cataract. So which means, is there a way we can provide much more balanced diet, food which is rich in the antioxidants? Probably it may not be possible today that can be done by any of the philanthropic organization, by the government. But it is only the socio-economic development of the whole country probably will address this. Probably the answer is not with this or with the government. So to conclude, I think we have made a lot of progress in the control of cataract blindness, but what we need to make sure is we have to ensure access and affordability of the cataract services. We need to develop physical and human resource infrastructure for primary eye care. We also overall have to increase the cataract surgical coverage. From today, it's about 6,000 to 7,000 to about 15,000, as Dr. Rao mentioned, and again with a special focus on the women, and also promote better dietary habits to slow down the cataract onset. Thank you.
Thank you, Ravi. Nag, you want to comment something?
I think it was a comprehensive coverage of the problem of cataract, the past, the present, and the future. And I think it is very well covered.
It's a fantastic presentation, sir. Really nice. Issue is that, of course, cataract prevalence overall is reducing, but still we are doing more surgeries. One important question, why it is higher in women? I think the most important factor is the life expectancy in women is higher. Since cataract is age-related disease, that's why it's much higher in women, sir. And nowadays even what we see that sun exposure, it is also important risk factor. We have done ICMR study on this thing, and probably it is one reason that cataract is not reducing. As far as number of cataract surgeries conducted in India, so we gave a figure of 2.70 crore surgeries to be done in 3 years. But this number is based on number of blind and visually impaired due to cataract. If we are doing a surgery in a patient with visual acuity in one eye is 6/36, otherwise better than 6/18, that is not part of that. And unfortunately in India, most of the surgeries are being done on those patients only. We have an example, Gujarat, even there the cataract surgical rate is more than 16,000 per million. Still it is not eliminated in Gujarat. So you can understand, until unless we'll give priority to blind and visually impaired, it is not possible to eliminate cataract blindness.
As Dr. Praveen said, I also used to think it's all related to the longevity of the women, but the data we have doesn't show that. Because at the age of 70 plus, the cataract surgery among men is more. And the trainee survey we did, we also found the visually significant cataract to be more among men above 70 years. It is lesser. As they become older, the prevalence of cataract also becomes lower in the women. So it all seems to be much earlier onset. So what our conception that because women live longer, there are more women in the population, we have cataract may not hold good from this data.
Another factor we noticed related to that is the percentage of women seeking cataract surgery is far higher in our secondary centers. That means when you take the care closer to them, they access it. If you expect them to travel a distance, women usually don't. So that's a factor too, looks like.
In your presentation also you mentioned one of the risk factors is women. And in what angle is that? Same, okay.
The percentage of women with cataract blindness is higher than in men.
We also looked at, because I saw this data, I looked at all the other diseases except diabetic retinopathy, all other diseases, whether it's a cornea, glaucoma, orbital, lacrimal sac, everything women is higher than men. I'm not sure what is the reason for that.
Maybe the women empowerment to go to the hospital.
Among paid surgery, what is the distribution between male and female?
So among the paid patients, there are far greater men get operated than the women. As he said, the women go to the free hospital and also more to the camp. But the men, I showed you that 43% men got operated, but if you take the paying patient alone, it's 50% men. But if the free side, it is 40% or less men and 60% or more is women.
Thank you, Ravi, for a wonderful presentation.